Hi, and welcome to my channel, Psychology Demystified. We're here again.
Yes.
I'm Dr. Karen, and this is Dr. Michelle.
Thank
who has
you.
graciously agreed to be part of part 2, and I'm thrilled and excited. So, as I said, you spoke, requested, yelled, some of you. I heard you, and here's the channel. I'm going to try and meet the expectations. Anyway, my goal at the end of the day is not so much to meet the expectations, but to hope that this is a knowledge hub for you if you've been looking for that knowledge about what therapy is. And as I said, we're demystifying psychology. So this is why we're here. So as we launch into part 2 today, which is finding the right therapist, that's what we're going to be talking about.
Yes.
Now, finding a therapist is not an easy task. There are very many names out there. Very many people out there. So how do you choose? How do you know who's the best? Just the way when you're choosing a doctor, how do you know who's the best OBGYN? How do you know who's the best dentist? There are like so many. How do I know? I might be told by so-and-so to go to this one, and then it's not the right fit for me. So we're going to try and walk you through what finding the right therapist might look like. And hopefully that will help you, a family member, a friend. Maybe after watching this, you will become a source of knowledge. At the end of the day, it's all about saying what we know and hoping that it helps you in the end. Yeah,
Absolutely.
So, as I've always said, it's never going to look pretty. So get used to the messy papers because they're going to happen. It's not going to be a nice, perfect shoot because I always like to reference people who I've read from, whose books I've referred to, and I like to make sure that I quote them verbatim because I don't want to butcher what they've said. They've done their research. They have their statistics. They're amazing. So there we go. So welcome again, Dr. Michelle.
Thank you.
I'm so happy to have you here.
Thank you for having me.
I am so happy.
Thank you.
So, as you can see, there's still a grin on my face from the first one. So now choosing a right therapist is like getting into a relationship. It is. You don't just launch into it, do you? You take a while, you think. You check whether it's going to work for you. You check whether you get along. You check whether you like each other. Same thing. It is a relationship. And that's what it is. It is all about the relationship. So one thing I found was Carl Sherman's book, which I think is amazing. And his book is called How to Go to Therapy. So if you have a chance to find it, look for it. Some of the things may be relevant for our context. Some maybe not, maybe won't be. But take from it what you will and go with the flow and see. So the most common factors that I've heard for people, how people choose a therapist is either through recommendation from a doctor, or these are the most common factors, or whether the therapist is part of your insurance plan. And another thing, of course, is how close they are to your home or work, and of course, cost. Those are just the most common. But then, of course, there are some that are the most important. Which other things have I forgotten about the most common that may also be the most important, but I'll get to the most important.
Referral from a friend. I think that's usually the biggest source that is really helpful because you trust your friend, you trust your family members, and if they say, you know what, I've been to see Dr. Karen, I had a really good experience and it really helped me, why don't you go see her? So it's coming from a trusted source, and that's always a good thing. And one of the things that I like to encourage people is that should you go and you find that you just didn't fit well with the therapist, that's okay. It's not, oh my gosh, it's never going to work. It's just, okay, that just didn't work for us. Her style or his style was different. And it just means you just keep looking. That's all. So it's always about fit. So go in, find out. Did you feel comfortable? Even in terms of, yes, there's the initial, fear or anxiety, but what was it that made you feel, okay, I feel safe and I'm ready to take on this journey? And if that was not it for you, that's fine. We just go down the list and look for someone else. What is it on the end of the therapist? I think there's also the responsibility of the therapist. Do they have good listening skills? That's really important.
That's big.
So you need to feel heard. So if you even went in with in a couple situation or a family situation, that each member gets heard. So it wasn't just the one person who seems to have been the most talkative is the one who got the attention, because then, okay, so how are the others feeling?
And why did they come if you're not going to listen to them?
Right,
exactly.
absolutely.
Exactly.
So making sure that you're feeling heard, even though the situation may seem dire, but at least there's someone who's saying, okay, I hear you.
I hear you.
How
I like
do
that
we
you
work?
said that because I love that you said yes so clearly. We do the same. Yeah, right. I hear you. Yeah. I love that you said that.
And let's see how we can unpack that together, right?
The therapist personality also matters.
Yes.
If your personalities do not mesh, it's not going to work. So that matters as well.
Right.
Another thing also is your connection with the therapist.
Yes.
Because as Dr. Michelle says many times, it's important for therapy to feel safe.
Yes.
So you have to have a connection. You can't connect with someone you don't feel safe with because then you won't open up to them.
Right.
So the connection is key. It's so big.
Yeah.
And of course, the therapist being active in your session as well.
Yeah.
Yeah. And of course,
they're not just quiet.
Exactly.
And you're just talking and it's like, okay, so what was the point of this? You know,
I could have spoken to myself.
Right.
Yeah, but why so that
Yeah.
kind of matters. It does. It does.
If I can jump on something that you
for
said
it.
earlier is if, for example, you don't find that you have a good connection with a therapist, it's important, and you know a good therapist when they're willing to help you find someone, because it's not about us.
Yes.
Yeah. My biggest joy is when I know that a client is getting what they need.
Yeah.
So if they're not able to work with me, it is my responsibility, and I really take it on to say, okay, let me help you find someone.
Let me refer you.
Let me refer you
to someone
Let's
else.
see if there's maybe other people who may be a better fit.
Yeah.
Because ultimately, that's what I want for you.
Yeah.
That's what we would want.
It's
that
such a big deal.
You get to at least deal with that issue.
Exactly.
So it's not to take, if they're taking it badly, if they're feeling some type of way about, why didn't they like me? Oh,
if they turn on you, run.
Right.
If they turn on you,
it's
run.
It's not about us.
Yeah, it is not about us.
Yeah.
It's not. And that's why, even though I know you guys find it odd that in the sessions I've done in the past, I've always said, awesome, if you want to see someone, go see Dr. Michelle. Because then you're wondering, how come she's not advertising herself?
Right.
Because I know the power of referral.
Yeah.
And I know that it's not about me. It's not about what I want and whatever money I may make or whatever. It's about you and what's best for you.
Right.
And that's why we do this.
Yeah.
We didn't do this for the glory, the fame. We did this because our goal is to help. So ego aside, a therapist should be able to refer you to someone else.
Yeah.
Yeah.
Absolutely.
And even to say sometimes that they don't know.
Yeah.
There is no therapist, and I've said this before, who knows everything.
Yeah.
There is no way I'd jump into the marriage and family therapy area because that's her area of expertise, and I would definitely learn from her, observe and ask questions, but I wouldn't just jump into it. And if I'm willing to jump into it, it's all about me, and that's not what a therapist is to do.
Right.
Exactly.
Yeah.
Another one, of course, is someone's age. Because sometimes the therapist's age makes a difference.
Yeah.
Especially when it comes to you. Sometimes it doesn't matter because someone may be older. Think about this. It's possible for someone to have a wall full of degrees, 24 years experience, and so many conferences that they've led, and you're thinking, this is going to be the best fit for me.
Yeah.
And maybe you're older than that, but then you find someone who's 24 years old, and you make a connection, and they're good at what they do.
Yep.
Sometimes the age, don't be too stuck on the age.
Right.
Because sometimes experience doesn't necessarily mean that you'll get along.
And I think we get a lot of that in our culture.
Yes.
They need to be older and have lived through life.
And wiser.
And, you know.
It's not.
But wiser, yes. But I don't need to be older to be wiser per se, isn't it?
But
right?
there's always that combination. They come together.
That's right.
They come together.
Right.
No.
Yeah. And there's something to be said to that my doctor doesn't have to have gone through sinus issues for him to be effective with the sinus challenges.
Or to have
or
a
to
heart
have
problem,
gone through
to
all
be a great
diseases.
cardiologist.
Right.
Yeah.
Right.
No. Yeah,
right.
exactly.
But they're well read.
Yeah.
They're personable. They are passionate about what they're doing. That goes beyond and cuts across that age thing, because that's something I've seen a lot.
Yeah, it is. Yeah. And even for us, because we maybe don't fit the profile that you would expect, we find that age does play a role, and then people are usually surprised by the fact that we know stuff.
Right.
And it's because that's why we just teach you, just put aside the age.
Yeah.
I may be younger than you, but it's possible to still be an effective therapist.
Sure.
For you.
Yeah.
So be open-minded about it.
Right.
When you're finding a therapist, because that really matters.
Yeah.
Religion as well, some people aim for that. Doesn't mean that because you're of the same religion that you'll get along. Doesn't mean that. You might find someone who is completely the opposite of what you believe, but they still understand where you're coming from.
Yes.
So sometimes that works for you as well.
Yeah.
And of course, when it comes to age also, I would say gender as well.
Yes.
When you're choosing a therapist, because if I am having issues with relationships,
Yeah.
and of course it's relationships with men, I have to think about my therapist. Do I want that to be a man because he might know the in, or can it be a woman? Which one am I comfortable with?
Yeah.
Because at the end of the day, you have to be open to opening up.
Yeah.
So,
And some
gender.
people have the preference for gender.
Gender.
They'll say, okay, I want to go to, and I want to see a male psychologist. I want to see a male therapist.
Yeah.
And that's okay.
Yeah.
But at least be clear on what you want.
Yes.
And that's some of the questions we ask when we're helping you find a referral. You know, do you have preferences? But sometimes the gender doesn't necessarily heighten the skill.
No, it doesn't.
Isn't it?
No.
That they'll be just as good.
Yeah.
You know, so again, I think I like the idea of being open-minded. I mean, why am I going to therapy?
Yeah.
I'm going to therapy because there's something I want to deal with. And if the person sitting across from me has the skill set to get me there, that's all I need.
Exactly.
Isn't it?
Exactly.
Yeah.
And of course, another thing now, the next part I'm going to talk about is, so we've talked about age and gender, we've talked about religion, we've talked about referrals.
Right.
And referrals, of course, could also come from, you know, your priest or whatever. But again, you know,
Yeah.
you decide what works best for you.
Yeah.
Another one I'll come and talk about is cost.
Yes.
Because cost makes a difference for you. Some insurance companies do cover therapy, some don't. So do your homework,
Right.
check and see what works for you,
Right.
and then go with that. Anything
Yes.
else to add to cost that I may not have mentioned?
I think also sometimes you may not be able to have like the money upfront because with therapy, it's a weekly basis. So it's a commitment that you need to make. And what you don't want is to start and then stop.
Yeah.
Because that's disruptive to the emotional journey. And so you'd rather call, find out, okay, how much does this therapist cost? I know that I'd want to work with them. If that is the amount, if I'm not ready financially, perhaps I can start to save up. So at least there's a few weeks covered that at least when I start, there's momentum.
The same way you would say for a pair of shoes
That's right.
and a bag
Right.
that
Right.
you are supposed to make you happy now.
Yeah.
Why not invest in something that will make you happy for a longer time?
Right. Yeah.
Yeah, exactly.
Because it's a personal journey. It's a life
Yeah,
goal.
exactly.
So look into it also just from the perspective of, okay, I would have wanted to start today. Out of that need just feels so dire.
Yeah.
But I may have to put that on hold just for a little bit, just so that I can save up. Sometimes family members and friends can help out. And that's okay too, where they say, okay, I may not be able to cover all, but I'll be able to do the 4 sessions and my mom or my brother is going to help me pay for the rest. And that's another combination,
Exactly.
another way to look through.
Exactly.
But the insurance company,
Yeah.
even if they're not on your panel, look to see how you can get them on your panel.
Yeah.
Look to see how you can get that coverage. Because slowly more and more, even local insurance companies are starting to cover.
As mental health becomes
health.
demystified,
Right.
they're starting to realize that
The importance
it's
of it.
important.
Yeah,
Exactly.
absolutely.
Exactly.
Yeah.
Of course, another one we've mentioned before is location, but with that is also availability. Some therapists might be able to take you in on weekends, but you know, or even after work.
Right.
And of course, you have to make sure it's close to you so you can get there on time. But those are things, those ones for the weekends and after work fill up really quickly. So you have to see whether that works for you and see what works.
And sometimes that means you put on a waiting list.
Yes.
Right?
Yes.
So just be patient.
Yeah.
If you know that that's the person you want to work with, just hang in there until, you make it to the top of the line.
Yes, yes.
So that also
Yeah.
is another thing that comes with
I'm
choosing.
I'm really glad you mentioned the waiting list because some people believe availability is now.
Right.
I need
No,
it now.
not necessarily.
Sometimes there's a waiting list because, again, if many people need to see that particular therapist and we want to do our due diligence and make sure they give them the amount of time that you would also ideally want.
Right.
We book sessions. So just always keep that in mind as well.
One other thing that maybe we haven't covered and we probably need to
Go for it,
is that
please.
it's important for you to clearly ask the credentials of your therapist.
Like it, because I was about to go
Oh, were
there.
you?
I love it.
Perfect.
Yes. Oh, you see?
Perfect.
That's why we've been wearing the same colors. Clearly. Yeah,
I don't even
as
know
I
how
said,
we-
it's unscripted. Don't plan this.
Right.
But great minds do think alike.
Yeah. Okay, so take
Go.
the lead and
no.
then, yeah, I
No,
can?
do
Okay.
it. You're on it. Go.
All right.
Yes.
So it's important for you to know that who you're working with is qualified.
Yeah.
We've had too many quacks in the country.
Yes.
I mean, I cannot overemphasize that.
Yes.
And so it's important for you to know, and I like it when my clients ask.
Yeah.
So what are your credentials?
Yeah.
Where did you get your degrees from?
Yeah.
So ask. If someone is dodgy about responding to that, move on
Yeah.
to the next person on
Yeah.
your list, because that's something, if anything, they should hold with pride.
Yes.
Right?
Yeah.
Because one of the things that we find is that there's too much harm that's happening in the area of mental illness by virtue of going to someone who's not qualified. And that's really
that's
dangerous.
so true. And that
Really,
unfortunately,
really dangerous.
what we've also discovered
Yeah.
is the fact that the term psychologist, people grab it and roll with it
Yeah.
too loosely.
Yeah.
Too loosely.
Right.
From what I know, I don't know
Yeah.
whether, from what I know,
Yeah.
a psychologist has a PhD,
Right.
a PsyD,
Yeah.
or an EdD.
Right.
So I keep saying DDD because
it's doctorate level.
Doctorate
all of them,
level.
DMFT, you
So-
name it.
yeah.
But it's doctorate level.
It is.
And it could be
is.
master's level as well.
Yeah, yeah. But depends on the
again,
field.
It depends on the field.
depends on the field as well.
Right.
Yeah.
Right.
So be careful with that
Yeah.
as well. So ask, and if they're going to step away from it or run away or not say, or they did
Yeah.
3 months or 2 months, then be wary of it, because that really matters.
Right.
It does. Degree is big.
I think when we look at even just being able to quantify that things have to be done ethically.
Yeah.
You know, so, and I know we'll tackle this in the next segment, but that forms were filled out. So, you know, sometimes I've heard of some clients who will say, but cost kept changing. Why would cost be changing?
I know.
You know, it's like, no.
Yeah.
The
If
price
you-
is so those are some dodgy things that are ongoing.
If you don't accept it for your food price to change,
Right.
your therapy price, you're
Yeah,
gonna, no.
just randomly like
No.
that. That's usually a problem.
Yes.
Yeah?
Yeah.
And so to ensure that, yes, that they even talk about their ethical code, that it's something that they are adhering to. So I just wanted to make sure, because that's
yeah.
and
Thanks
I
for
really
bringing
have
it
to
up.
recommend, I know currently like the Kenya Psychological Association is doing a lot of work to try and clean this up, to, you know, weed out the quacks from those who are rightfully practicing and have the proper training. So you could even call them and ask, okay, is this person, or how do I go about, do you have a list? At least you know that there's an organization in the country
And
that's
that is
helping
so
with that.
true, because when I had to get my KPA
Yes.
certificate,
Yeah.
it took about a month.
Right.
And that's because, not because they were slow, they were
Yeah.
the most efficient people ever.
Right.
But I had to send in all my transcripts,
Right.
my degrees,
Yeah.
everything. And then a panel had to look at them,
Right.
verify that they were legit,
Yes.
and then decide
Right.
whether I could be on the list.
A member, yeah.
And I loved that.
Yeah.
If it had been given to me in one day, I'd have been truly disappointed.
Yeah.
So KPA, kudos.
Yeah.
Kudos for doing that, because
Right.
you're making sure that this profession gets the respect it deserves.
Right.
Yeah.
We really need
So
that.
thank you for
Yeah.
that. Exactly. And of course, therapeutic orientation. I'm sure you're like, what is that?
Right.
Now, therapists work with different treatment methods,
Yeah.
strategies, modalities. We have many words for it, theoretical orientations, which means that when we do therapy, sometimes some therapists are very stuck on one way of treating, and then some are not. For example, if I'm going to talk about theoretical orientations, I'm someone who considers myself an eclectic integrative therapist. And that means I use a whole bunch of different theories. I'm trying to make it not be too crazy.
Yeah.
Whole bunch of different theories aimed at making sure that my client is my priority.
Yeah.
So I will use cognitive behavioral therapy. I will use play therapy. I will combine them if that's what I deem necessary for you. That's how I operate.
Yeah.
What about you? What do you do?
I guess marriage and family therapy maybe has a few, they have kind of separate skill sets, but it's the same kind of thing. It's like, okay, out of all the theories that are out there, what works best for me in my personal style? What framework do I use? What lens do I use when I'm working with clients? And so being able to articulate that to the clients is also very important. It's something that, you know, the clients should have a question. Okay, how do you work? If I'm bringing my child to you, what should I expect?
Exactly.
You know, because usually there's a lot of fear in that, you know, for parents to make sure, did I leave my child in the right hands?
Yes.
So being able to talk about, the therapist being able to talk about what they're going to do effectively, I think is a really important thing, because it should give you confidence. You know, this is what we're going to do some play therapy, we'll do some sand tray therapy that I use. We'll use this technique. I'll bring in, for me as a family therapist, I'll bring in the parents at some point. So at least they have an idea of what to expect.
What's coming. Exactly. And there are many, many different modalities. Look it up. Treatment modalities. Look it up and see all the ones that exist. There are so many, we couldn't go through all of them. But you know, just find out whether that's going to work for you at your therapy session, because that matters as well. Of course, expertise. Someone's training, as we mentioned, the degree. So of course the degree is one thing, but their training and expertise. As I said earlier, we do not know everything. So for whatever you're seeking help with, make sure that person is trained in the area that you're going to seek help in. For example, something like grief therapy. She's amazing at grief therapy. It's something I'm still learning. My ideal thing is, if you come to see me and you want to get grief therapy, my ideal thing as a competent, ethical therapist is to refer you to Dr. Michelle. That's what I would do, because that's how it works. However, if you're coming to me for child protection issues, then of course I'm happy to take you on. If you're coming to me for eating disorders, then that's something that I'm trained in and I can handle that. So, but I'm not going to jump into and I should not ever jump into a field that I'm not comfortable with or trained in. So expertise does matter. Stay away from someone who says, of course, that, I'll do it, that, I'll do it. That doesn't work. It really doesn't. Doesn't. Anything I forgot?
No, I think that one you've covered it all.
And we know that's a lot of information to go through. But at the end of the day, it's important to make sure that when you're choosing your therapist, take your time. It's not a race. Trust your gut. See how you get along. You will know when you're sitting. It's the same way when you're meeting someone for the first time, a friend. Trust your gut. Same thing with a therapist. Check. Trust your gut. Trust yourself. See how it works. Make sure it's a relationship that works. Because one thing we've always learned that from when we're doing our training is that it's all about the relationship. So keep that in mind when you're choosing your therapist. It's all about you and the relationship.
Very good.
Anything I forgot?
No, I think that pretty much covers it. That's what actually, as you were talking, I'm trying to think, did we cover it all? I think we did. And if we haven't, or if you have a question, just ask.
Please.
You know,
please ask.
Even if it's the therapist that you are wanting and potentially would want to call, just call and ask, you know what, this therapy thing seems scary. Can you tell me a little bit about it? I have one question. Could you clarify this for me? It's always okay to ask, right?
It is. So thank you so much for joining us today. I really hope this is going to help you or a family member or a friend of a friend. We'll keep doing this. I will have Dr. Michelle on periodically. It depends. Maybe we'll change. We're still trying to figure out the flow of this. Thank you for being patient with me as I try to figure out what this YouTube world is all about. Thank you for being so kind. We truly appreciate all your comments. Please feel free to comment, ask your questions. Remember, not for advice, because we will not give you advice, because that's not what we do, and I'll repeat that over and over. But please feel free to comment below. Please make sure you subscribe, because that matters. And once you subscribe, I'm sure you will find out when session 3 comes out. So thank you once again.
I
appreciate this.
Thank you.
I really do.
Yeah.
And bye.
Take care.
Take care.